मेजर जो मंत्रालय हैं वो पढ़ा लिखे आदमी।
Meeting call to order.
I request President Rotarian Ritika Gupta to please confirm the minutes of the previous meeting.
The minutes of the previous meeting were circulated on the group and no objection or query has been raised. Hence, the minutes of the previous meeting are confirmed.
Thank you, President. Today, we have a very important topic. Impact of...
Sorry, I think some echo is coming. Can I am hearing or?
It's fine, sir. It's sounding good.
No echo.
Okay, go ahead.
Okay. So today we have a very important topic, which is impact of obesity and diabetes on organs, their challenges and remedies. And no other better than Dr. Ramen Goel we have. For giving the introduction, I request Dr. Rotarian PHF, Dr. Rohan Monis, to kindly give the introduction. Please unmute. Please unmute.
Hi, good evening, everybody. Good evening, fellow President and fellow Rotarians of Rotary Club of Organ Donation International. Well, it's my privilege to introduce to you Rotarian Dr. Raman Goel, who is not only a pioneer, but a teacher and also a very poignant thought leader. He's been a pioneer in diabetes and bariatric, and he's one of the bariatric surgeons from Mumbai. He's the director of the Center of Excellence in Bariatric and Metabolic Surgery at the Wockhardt Hospital, Mumbai. He is also the founder-president of the Diabetes Surgery Foundation. He's the founder editor of the Journal of Bariatric Surgery and has over 40 research publications and book chapters. He is the chief trustee of the Indian Association of Gastrointestinal Endosurgeons, IAGES. He is also a member of the specialists of the board of the National Board of Examination, Government of India. Without further ado, I welcome and introduce and a hearty welcome to you, Rotarian Dr. Raman Goel, to our club for this beautiful talk. Thank you.
Thank you, Monis. Over to you, Dr. Goel.
Thank you, Dr. Monis and President Ritika, Honorary Secretary Ruby Agarwal, and other members of my club. Nothing could be bigger honor than making a presentation in this club after almost 2 years. I was really very anxious that, this club is such focused club on organ donation. And I basically treat obesity and diabetes. And so how do both things go together? But I'll be making a brief presentation and I'll be very happy to take questions at the end. I'll just start my presentation and then we can discuss. So are you able to see my slides?
Yes.
All right. So basically we are going to talk to you today about obesity and diabetes and how it impacts various organs and the organ transplantation. I work at Mumbai and I've been doing this for a long time. So obviously different associations and all those things automatically come. Now, as far as obesity is concerned, obesity has become a pandemic now. I mean, we all know the pandemic that we recently came out from COVID, but obesity has been there for a longer duration and it's increasing. They say almost 30% of the world population is either overweight or obese. And in India, it's no less. It's gradually catching up. And which is a bigger number than the malnourished population of the world. So this is important that we are at a tipping point now where we have overcome the undernutrition or people who are hungry. And now we are seeing a situation where people are either overweight or obese. And because of this, in last 1 year or let's say last 6 months, There has been a lot of focus on obesity. Our Honorable Prime Minister himself has raised this point at various forums. And once he took up the issue, the various media, social media, and the focus has come. To the extent now we say that 20% of the families have everyone who in the family who is obese. So that means, and this is more related to affluence, which is actually very different than what happens in developed world. In India, still the affluent families are becoming increasingly obese, while those who are living in poorer areas, poorer surroundings are still not, but they are automatically going to be there because economic development will make them eat and live the same kind of lifestyle what the affluent people are doing. And because of this, it's a big crisis that's happening in our country. And at the same time, and why I chose both the topics together, because both of them almost go together.
उधर उधर तो हमारे तुम्हारे जैसे लोग कराएंगे.
Obesity leads to more diabetes. And if somebody is diabetic and puts on weight, then it becomes a worse diabetes. Now, these are very recent publication 2023, where they have shown in which areas of the country diabetes is more common. As you can see, the red ones are the states where the diabetes is more common. And this is more of a urban phenomena. If you see what I'm highlighting, this red area is urban, and in rural area, diabetes is not that common except in few places like Kashmir, like Kerala here, and Himachal there. But the scary part is that pre-diabetes is happening in those states more which have been safe up till now from diabetes. So there is more pre-diabetes in these areas which are actually, if you see on the left side, do not have diabetes. And pre-diabetes is across, whether rural or urban. So when these people will become diabetic in next 5 to 10 years, almost 47 to 50% population of India will be suffering from diabetes. It's not a easy task. I mean, some of the top endocrinologists in the city says that this obesity and diabetes together are enough to bankrupt a country because of its impact on the productivity of people, cost of treatment, and complications. So I'll just go back one slide. Yeah. And this is again a recent data which says that even with all the medicines and all the education that goes with it, almost 77% of people who are having diabetes are uncontrolled diabetes. And this is a problem. Now, obesity leads to, it's not a cosmetic issue. Obesity leads to multiple problems, more than 230 health problems that come with obesity. Some of them are metabolic, like asthma, like fatty liver, gallstones, infertility, a long list of them, diabetes included. Some of them are mechanical just because of the sheer weight, like the knee joints wear off over a period of time. People have sleep apnea, they snore at night and they are not able to sleep well. And then there are some psychological issues which come with obesity, like depression, anxiety, feeling low, feeling worthless, not getting enough jobs. And those are real challenges that we have been seeing for last 25 years now. On other side, diabetes has multiple health problems. I mean, commonest with diabetes leads to blood pressure problem, but almost 53% of patients have at least 2 complications of diabetes. So it's not only diabetes which is happening, but it is also diabetes leading to multiple complications. Today, I'll be focusing only on organs and organ transplants. So this was just an initial introduction about the issue. So I'll start with the impact of obesity on organs. Now, obesity, so I'll be talking mainly 3 organs: kidneys, heart, and liver. And obesity initiates and worsens kidney diseases. Obesity leads to heart diseases and leads to fatty liver. and which can lead, if untreated, to organ failure, which may require an organ transplant in times to come. So obesity is one of the major reasons, and now it is called mother of diseases. There was a time about 100 years back, people said that if you know syphilis, you know everything in medicine. Now they say if you know obesity, you know everything in medicine, because obesity is mother of diseases and is the reason why people have so many health problems. Now, what happens when somebody is going for a transplant and is having suffering from obesity? So those who are, let's say, about 20 kg overweight are generally not accepted to receive an organ. People who are about 30 kg overweight, there is a contraindication, means they cannot receive a kidney. So we get patients. Actually, I asked one of my patients who stays in Thane, who was referred by a kidney transplant surgeon, that you please bring her weight down with bariatric surgery. And then she had a surgery a year later, a transplant surgery, and is doing very well. But somehow our Zoom was not working today. So there is a contraindication. The higher the BMI, generally the kidney is the transplant, they are not put on the waiting list for the transplant, because obesity may result in higher complications like skin infections, pneumonias. Obesity also has diabetes, so there are those problems, higher number of deaths during transplant, and then there is a possibility of organ failure after transplant. So this is one major issue. And what happens that not only they are not given the transplant, they are also at a higher risk of gaining weight after a transplant. So then somebody who is BMI 30, that means who is about 20 kg overweight, is almost 20 to 40% higher risk of death and failure of the organ that they have received compared to a normal weight person. And if they gain weight after transplant, it is a bigger determinant of death and organ failure than those that are pre-transplant weight. So somebody is overweight before transplant, they are as such not given an organ, and if they get an organ, they are at a risk. But if they gain weight after transplant, that is even a bigger risk in terms of organ failure and death. And there's a lot of data. I have not put the data here, which we generally do it in the surgeons meeting, the references. Now, what happens in those who are going for kidney transplant? That a person with obesity, they have longer hospital stay. There is 19% higher failure rate of their received kidneys, and there are 7% higher deaths, which is quite substantial if you realize the number of kidney transplants happening worldwide and number of patients who are suffering from obesity and requiring kidney transplant. So it's not a small number, and which is a major area of concern. To the extent that American Society of Transplantation says that if you want to receive kidney transplant, you must be under a supervised program with low-calorie diet, behavior therapy, and physical activity, so that you try to bring your BMI under 30. All right. So under 30 means you should be less than 20 kg overweight, and then the results of transplant improve. So what happens? These people are put on a longer waiting list. They do not get immediate transplant, and because they are on longer waiting list, they are on dialysis, and they have more complications and more deaths waiting to reduce their weight or waiting to get a kidney compared to somebody who is a normal weight. Now, if somebody also has diabetes, then we know that diabetes, if there is blood sugar is controlled, then it damages the lining of blood vessels of the kidneys, which filters the blood and removes the waste. So once that is done, then the kidney damage happens. And when kidney damage happens, then the blood pressure also increases, which is like a cycle. Then it further worsens the kidney damage, and these people will require dialysis or kidney transplant. So basically, obesity leads to diabetes, diabetes leads to kidney damage, and kidney damage may lead to requirement of kidney transplant. Doesn't happen with everybody, but if it happens, this is how it goes through. Then how do we manage, what happens if impact of obesity on heart? A person who is suffering from obesity, the heart works harder to push blood against the excess weight. And because of this continuous pushing of by the heart, the heart's structure and function changes over a period of time. The heart dilates and the heart failure can happen. There are many other things which happen with this, but probably the most scary thing is that obesity leads to sudden cardiac death. Even if there is no heart attack in past, even if there is no blood vessel block. So these are the scary part when somebody is suffering from obesity and has a heart problem. Now, what happens if this person requires a heart transplant? Again, the same thing. They are less likely to receive a heart transplant. So this has been the trend that they were put on a longer waiting list. It has been changed in 2018. Now they are allowed to a transplant. Rather, they are allowed early, but their complication rates remain still high. So the risk of waitlist death is higher in the people who are waiting longer on the waiting list. And then there is a possibility of transplant failure or the death. Then second thing is that if the heart size is different, so somebody who is obese and has a very large heart and now suddenly gets a heart which is very small from a thin person, so the margin of error should not be more than 30%. So if the heart is smaller by 30%, then this person cannot receive that heart. And this is a challenge because you need to have a donor also who has a larger heart to be able to fit. This problem doesn't happen with kidneys and liver, because in liver the liver can grow, and in kidney the blood vessels can be matched. But in heart this is a challenge. And then these people also have associated diseases. Most of the patients with obesity, like diabetes, blood pressure, cholesterol, and thus they are likely to have more transplant complications during the transplant or after transplant. And as far as diabetes is concerned, it is a serious complication of diabetes, even in absence of other heart disease. So this is important, that we must realize that it's not necessary that somebody has a heart attack, then the heart will be affected. In a diabetes, the heart can be directly affected because diabetes affects the blood vessels and nerves supplying the heart itself. And that leads to insufficient pumping, and which can lead to heart failure. So even if the person has not developed a heart attack, the heart can fail because the person is diabetic. And it also affects the heart muscles, and which a condition is called cardiomyopathy. And because of this, there is a issue of heart failure. The last organ that I'm going to talk to you about is liver. So we all know fatty liver is a very common thing. In India, we see it, and I see it on almost 100% patients, but I treat obesity patients, so all of them have fatty liver, but on an average, about 60 to 70% population has fatty liver. Now, fatty liver is a very serious issue. Earlier, we simply used to say, because you have weight, you have fatty liver. But fatty liver is associated with diabetes, cholesterol, blood pressure. These are the same problems that you will see across. And then just a pictorial thing. This is a healthy liver on the left side. This is a fatty liver. Then when fatty liver becomes inflamed, become diseased, okay, it causes problems. And then if this inflamed liver is allowed to remain like this, then it goes into cirrhosis. Now, up till this stage, up to inflamed liver, it is a reversible situation. You can see the green arrows here. So the green arrow shows that this is reversible. And if patient is managed well at that time by a gastroenterologist or by a physician, or if person loses weight, this reverses. But if this is not treated, then they have cirrhosis. So many of our friends and patients had cirrhosis and have lost their lives. And if cirrhosis continues, then some of them may develop a cancer of liver. And then these people may require a transplant or may not have a good life after that. Now, what is the progression risk? Because the possibility of fatty liver is so much, but how dangerous it is. So a fatty liver, there is a 40% possibility that it will proceed to cirrhosis. So do not take fatty liver lightly. People take diabetes more seriously. People take blood pressure more seriously, but they do not take fatty liver seriously. But imagine this 40% possibility of fatty liver progressing to cirrhosis ultimately over decades, over years or decades. Then almost 45% risk that this cirrhosis will lead to liver failure. Now, we all know you have been talking on this in this program. I've been hearing about liver transplants for years, but for last 2 years. But imagine this, that this is when the population, 60-70% population has fatty liver. And if you look at the progression, you will realize. And then the risk of death with just fatty liver, the risk of death is about 12%. If somebody has cirrhosis, is 31%. If somebody has liver failure, is 51%. And obviously, if somebody has liver cancer, then the prognosis is really bad. So liver is something, I'm sure there's been so much focus in this Rotary Club of Organ Donation on liver transplants. But what we need to realize is that this is a preventable condition. This is something where an early action can help improve outcomes. Now, this I've already spoken about it, but what happens when somebody requires a liver transplantation? There are higher complications and longer hospital stay if somebody is suffering from obesity. Then because that person is going to have transplant, then the associated problem worsens, and that will affect the liver itself. Like after transplant, sugars may go uncontrolled or may develop cardiomyopathy. So the organ may be affected. And if person is suffering from obesity, even the received liver may develop into fatty liver and will not function at its best. So this is important to realize that just because somebody donated a liver and you got a liver and you do not follow the lifestyle, you do not improve things can go south very fast and they can worsen. So it's important that these patients who have received liver become aware of that they will be wasting an organ if they do not look after their health well. So this was about the scary part, but what are the treatments available for this? And this, I'll be very brief because I want to take more of questions from you. So I'm clubbing this because, whether diabetes or weight loss, the treatment is almost similar. Lifestyle changes, medicines, or intervention. Now, we all know lifestyle changes are the same, diet and exercise. I'll be briefly talking about it in one more slide. Diabetes medicines are well known to everyone, but there are new medicines for obesity management, which are also used for diabetes. So I'll be covering that today. And briefly about bariatric surgery. And then obviously you have to control associated problem, whatever is there, whether it's diabetes, blood pressure, cholesterol, fatty liver, whatever it is there, those things have to be managed at an early stage. Now, the lifestyle changes, there is a lot of controversy about different diets. But scientifically, what we say is that accept any diet that a patient can follow in long run, whether it's intermittent fasting or whether it's FODMAP diet or whatever diet you want to do, Atkins diet. If you are willing and are able to follow it for next 10 years, that diet will work for you. But because the main consideration is health, it should be health and not weight loss alone. But on an average, people lose 5 to 10% of their weight with diet. Now, as far as exercise is concerned, and I've been talking about fit for years, and there are now very strong publications that exercise is not a good tool for weight loss, because if somebody doesn't change diet with exercise, they are likely to lose only maximum 2%, otherwise 0%. But exercise is very important for overall health, so I'm not saying that don't exercise. I'm saying everybody should exercise, whether a person is suffering from obesity, person is thin, but do not put too much emphasis on exercise for weight loss. But the fact remains that with lifestyle changes, 92% of patients who follow lifestyle and are successful are likely to regain weight within 3 years. Because this is a disease. The patient is not responsible for this problem. He or she is suffering from this disease and is not culprit. So this is important. Just like diabetes, just like blood pressure, obesity is now known as a disease. And just making lifestyle changes is not enough. Now, the new obesity medicines, there is a lot of excitement about them. They are same like a gut hormone that we change after surgery. They are like different by different names, GLP-1RA, GIP. These are different hormones. Primarily, what they do is they help in control of hunger and also cravings. I mean, it has been shown that they reduce alcohol addiction. Also, they reduce smoking and all kind of cravings like chocolate cravings or sweet cravings. They give feelings of fullness, and they also encourage slow emptying of stomach. So there is a prolonged fullness of stomach. And they are quite effective for diabetes and weight loss. They lead to 15 to 20% weight loss. So if you look at diet and exercise, which I just showed you, and now this is almost 3 times of that. And obviously, when you are doing medicines, you are also doing lifestyle change. I'm not saying that you're not doing, but the effective weight loss is almost 20%. And this is just the beginning. Maybe better medicines. I know the better medicines are coming, which will give better weight loss. The only issue is that one needs to take this injection once a week and simultaneously has to do lifestyle changes. The issues are that when they are eating so less, they are likely to have muscle loss. They are likely to have deficiencies of vitamin. And that's how you see some of those social media posts that somebody's cheeks have gone up and looking very weak and all those. But they are basically because those things have not been taken care. But in programs where these things are taken care, these problems do not happen. Then some of them may have side effects like nausea or constipation, diarrhea, but these are manageable side effects. These are the more common side effects, and they are manageable and with early intervention. The more scary side effects are very rare, and they are not reported in human beings. They are reported in animal studies. So I think we can safely assume that these medicines are good, and we prescribe them every day, and we manage these patients every day. So I think only challenge is that these people have to take these medicines lifelong, because if they do not take these medicines lifelong, the weight is likely to come back. So gradually realization has come worldwide, especially in FDA, US, that obesity is a chronic disease like diabetes, like blood pressure, and people have to be on medicine. Lifestyle changes alone are not enough. If and when people will start accepting this, obesity will be much better managed. And as I say, a lot of our patients are on this and they are doing very good, very well. So I think one of the challenge at the moment is cost, but I think that's just a matter of time as more companies and more Indian companies will be producing. This cost will become a less of an issue. Then at the end, I come to what I do. I've been doing for 25 years. I'm a bariatric surgeon, and I started doing diabetes surgery in this country about 3 to 4 years back. These are all laparoscopic surgeries. They lead to weight loss of almost 80% of the excess weight loss. And as far as diabetes is concerned, almost 80% patients maintain their blood sugar even after 10 years. So when you look at the medicine managements, 80% are uncontrolled, and we are here saying that 80% will be controlled even after 10 years. Because after these surgeries, we are altering multiple hormones, the same hormones that now the pharma companies are marketing. So the GLP-1, GIP, PYY, ghrelin, and many more hormones. So there are multiple hormones working together so that the weight loss is better and diabetes control is better. Actually, for diabetes, this works better than even for obesity. Within a week, most of the patients go off insulin, and within a month, their HbA1c drop down by almost 2 to 3. So this is an effective treatment. At the moment, we are offering it to patients who are at least 8 to 10 kgs overweight for diabetes. For obesity, those who are about 15 kg overweight or whose BMI is more than 30. So these are basically the technical criteria. The important thing is once patient loses weight, whether with bariatric surgery or with the medicine, they become suitable candidates for surgery. Now, medicines have come very recently. We have done these surgeries before kidney transplant. We have done these surgeries. I mean, I have not done, but surgeons have done with kidney transplant. And I have done this surgery after liver transplant for weight loss. So these surgeries are can be done in transplant patients to make them suitable for transplant, to give them better lifestyle, to give them more survival of their organ if they lose weight. And the surgery is the only treatment option which is covered by insurance. Medicines are not covered by insurance at the moment in our country. So I think I would just summarize this in my last slide. Obesity and diabetes are major contributors of organ failure. This is probably the biggest failure. 50% of kidney failure patients have type 2 diabetes. So one has to realize that major part of kidney problems are coming because of diabetes. The liver failure is mostly happening because of obesity and diabetes. These diseases limit transplant eligibility, so they are, and which leads to longer waiting list, complications during the waiting period, deaths. They increase transplant complication. They limit graft survival. So once the organ has been transplanted, they are unlikely to survive for a long time. Weight loss and blood sugar control are essential to improve transplant outcomes. So I think I can't emphasize more that these, though you are talking only on organ transplant, this prevention of organ transplant can happen in any family physician's clinic or in all the hospitals all over the country, that the patients are better managed and they will survive better. They will require less of organs. So I'll conclude my talk here, and I again wish to thank the leadership of the club to invite me, to give me this honor to present this in my own club, and I'll be very happy to take questions.
Thank you, Dr. Goel. It was a very, very informative session. Now I open the forum to all members. Please unmute and ask your respective questions.
I would like to ask a question. Yeah, Mr. Goel, that was a very, very informative presentation, and it was really enlightening. I just wanted one thing that caught my attention was when you were talking about the medication. So you said that you recommend a patient who starts having the medicines to continue eating them lifelong. Now, I wanted to just inquire if there's like any side effects that happen if a person kind of drops the medicine in between, or it is solely weight gain that you're talking about, and how effective is it that if a person has the medicine for a certain duration while dealing with what are the side effects that can a person expect, or anything around that, if you can just share.
So at the moment, the all the knowledge that we have come is the research knowledge. These medicines have undergone 5-year follow-up research. We are also doing clinical trials for these molecules in our hospital. And so what they have shown that if somebody discontinues the medicine, the weight comes back. Okay. Now, what you are asking that if they will start again, whether it will be effective, or by withdrawing, will there be any side effects? So I think the side effect that happens is that weight can come back or sugars will not remain better controlled. But whether it will remain effective, no study has been done. So the thing is that it's a real life situation where people will be discontinuing, restarting, and we will have that data coming up soon. But I don't have any doubt that there'll be no problem, because this is not like steroid where you suddenly withdraw, then some problem will happen. Even now, for last 2 to 3 years that this medicine is there in US and other countries, millions of people have gone on this medicine, and 80% of them have discontinued within first 1 year. So because of cost reason, because of side effects or whatever. So I mean, the only issue has been the weight gain. There'll be, I don't think there should be any other issue.
Thank you very much.
Yes, Rotarian Ramnath Pradeep ji, aapne unmute.
Yes, Doctor. Good evening.
Good
It
evening
was
to you.
very enlightening. I especially came back to hear your presentation and see your presentation today.
Thank you so much.
It is very interesting to note that I have my 3 observations, and I would like to get clarification from you. One is, you have not told that why this is happening. What is the the reason for these things. Lifestyle changes is one part of it. Now whole world is changing in terms of lifestyle. Now India cannot be, but at the same time, I think India is up today require more of a prevention side rather than other side. Other side will continue to be treated, but prevention side is more required, like keeping the organ healthy. Now the question is how to keep the organ healthy. Now you said that exercise will not help much. Medicine only can help to some extent, or both. If simultaneously taken, it can help us. Now I have seen my own experience. I am diabetic for the last 15 years. The medicine which my doctor has advised in 2009 till date, I continue to have the same medicine, except some, the percentage of power gets changed, but same medicine. I have been very, I have been trying to ask this question and get some answer, whether this is reversible or not reversible, whether it is a diabetic, whether it is a obesity, whether it is reversible. If reversible, within how much period? Because if you have to continue to take, during this 5-10 years period, I must have taken tons of medicine, which is basically chemical, which is impacting much more than any other medicine. So why doctors are keep on prescribing the same medicine again and again from the same type of companies? I have seen this. I continue to have the same medicine for the last 15 years.
Yeah.
So my question is whether the medicine can be changed,
Yes.
whether this can be reversed, whether the diabetes can be reversed or not. There are many people in the market. There are some doctors, they must have also done some research. Based on that, they say that it can be reversed. I tried 2 times to get it reversed. I came back to my original, the average figure about 5. But again, it got engaged. Today also, I am within the range. but I'm sure, and we are controlling our food habits. Now, food habit side, we are having the same food habits, same food for the last so many years.
Yeah, I think I will allow Dr. Goel to
So can I
respond.
complete it?
Yeah, please go ahead, sir.
Because there's so many people who are waiting in the line. Yeah.
So I'll stop it if you wish to answer, because I got 3-4 more questions to ask.
Okay. So, Mr. Pradeep, basically, I'll tell you, number one is prevention. I think prevention is the only way. You have hit the nail at the right place. Treatment is not going to work, because if 50% of the population is going to have diabetes, the cost of treatment itself will be so humongous that country can't afford it. So prevention, and I think recently, just about a week back, discussion started about samosa jalebi. I have put it in the slide also. This is such an important thing that has come from the government. It has come late, but it has come. That we are now highlighting where we are going wrong. By putting the name of samosa jalebi, this is so important, because I know some of the people who are on the panel which decided this. Instead of saying pizzas and burger, the message is being given that our diet needs to improve. We cannot blame the Western food always. We need to look inwards and say that whether it's Indian food or Western food, whatever is unhealthy has to improve. You have made a very important observation that why this is increasing. One of the major reason is the diet only. The disease is there, but disease will worsen if the diet is unhealthy. So if, like you said, you are one of those persons who is taking the same kind of medicine for 15 years and
Yes.
is well maintained. But if you are eating unhealthy, your requirement of medicine will keep on increasing and your sugars will not be controlled. So disease is one part, control is another part. And the unhealthy lifestyle makes it worse. So a lot of us have inherited obesity, let's say, or inherited diabetes. Now, somebody who has inherited obesity and eats unhealthy is bound to become overweight. But if he is eating very healthy and is exercising regularly, is not going to gain that much weight. So I think it's a mixture of both. I have never said that exercise should not be done. I'm saying exercise is very important for your health, for maintaining your weight. But exercise role is specifically in weight loss, because I have seen young boys and girls being pushed into gym for 2 hours by their parents because the poor girl is not able to lose weight. No, that is wrong. The focus has to be on the nutrition, not on the exercise. And if you do that, yeah, if people realize this, everybody should exercise, and gradually the diet has to improve, because the diet is the bottom line. When we operate, when we give medicine, even medicine works by restricting food intake, by reducing your capacity to eat, by reducing your food cravings. So I think a behavioral change has to come. Like a clean nation, we need to have a healthy nation kind of momentum being built up in this country, that we gradually give up on these unhealthy food items that we eat daily.
Thank you, Dr. Goel, for answering that. I now, Dr. Kamal Jain or Rotarian Sunil Gupta, you have raised the hands. Yes.
Yeah, I'll ask a question. Thank you for a very insightful talk, Dr. Goel. And personally speaking, I'm a kidney transplant recipient. For the rest of you, I will also let you know that I do consult with Dr. Goel time to time, and he's been very, very helpful. I take Manjaro, which is one of these GLP drugs, and has completely helped me with reduction of body weight. My BMI is normal, and I've shed over 20 kgs. I do have post-transplant diabetes. I never had diabetes before, but I got that condition because the transplant drugs that you have to take also affect the pancreas. Anyway, enough about my history. But the question I had, Dr. Goel, was regarding the diet itself. Now that I'm in normal ranges, I'm trying to increase my protein intake, et cetera, et cetera. But the controversy of Western diet versus, a plant-based diet. If you wouldn't mind talking about that, is there something that can be done that I can reduce my level of Manjaro going forward? Since there are side effects like muscle loss.
I think for somebody who has received kidney in past, Mr. Gupta, having enough proteins, having low glycemic index food is what is going to help. Whether you do it with a Western diet or whether you do it with Indian diet, it's the same. Avoiding red meats as much as possible. I mean, I know it's for some people it's not impossible, and having once in a while there is no problem. So I think basic concepts are the same. Anybody with diabetes, the primary focus is low glycemic index food. And the two items that has been highlighted by ICMR recently in India, the samosa and jalebi, are among the very high glycemic index food, and is eaten by people without realizing. Even if somebody doesn't have a diabetes, it can they spike up the blood sugar even in non-diabetic and causes hyperinsulin secretion. So I think for you, what you're doing is excellent. I am aware of your history that you had a transplant long time back, and you are maintaining yourself well. So just keep it up, and yeah, eat healthy, stay healthy, exercise regularly. I think exercise is something which is underplayed. Exercise reduces insulin resistance. For a diabetic, exercise is even more important than a person with obesity, because exercise increases uptake of sugar from the blood into muscle. So it basically reduces insulin resistance. So if somebody is exercising, his sugar is better control. I'm sure Mr. Ramnath Pradeep must also be exercising, and that's why he is happy with his blood sugar control after so many years.
Yeah, Dr. Kamal Jain, please unmute yourself.
Yeah. Good evening, sir.
Good evening, Dr. Jain. How are you?
Good evening, sir. Sir, first thing will be for all our members who are attending. As a Rotarian and as a member of organ donation awareness, this group what we have, we the members should know that what are the criteria. Like there are lots of myths. Why organ donation is not happening? Now this is one of the thing. Obesity is one of the thing which is preventable. When there is any operation, before operation fitness is taken. If patient is not fit for surgery, even if you are having someone to donate you operation cannot be done. So this is a very big part. Obesity is a very big thing for a transplant that we all should know, and it should be promoted that cut down your weight or you will lose the organs. Now, sir, my question to you will be, can obesity increase the risk of certain types of cancer? And if so, which one?
Okay, Dr. Jain, yeah, so about 12 types of cancers are known to happen because of obesity. And these are the cancers of breast, cancers of esophagus, cancers of uterus, cancers of colon, and obviously cancer of liver. And it's a major problem because because of obesity. Now in our country we have more cancers related to lifestyle changes than the cancer that we have earlier, which was because of the infections in the vagina and all those areas. And not only it increases risk of cancer, the cancer is diagnosed late. So if somebody has a small lump in the breast, the woman can identify, a normal weight woman can identify it. But if somebody is
Obese.
obesity, a cancer is diagnosed late and they present with advanced cancer. So I think with cancer there is as big a issue as with transplants. We all keep talking about cosmetic aspect of the obesity, but we really do not talk much about the serious, very serious impact of obesity on organs and on cancers. Thank you for raising this issue, Dr. Jain.
Thank you, sir.
Dr. Goel, thank you for the presentation. It was a beautiful talk. Well, just a few markers, sir. In terms of BMI, is BMI still used as a marker, or is it like the waist hip ratio? Because for the last couple of years, there's been a lot of tussle around that.
Yeah. So, Dr. Moniz, the waist hip ratio and BMI, this is ongoing. Academically, we know that waist hip ratio is definitely better. We are not talking of waist height ratio also.
Yeah.
But BMI is such a simple thing.
It's very simple, right?
Everybody can find their BMI. Just stand on a weighing scale. Your height is always fixed, and you know what is your today's BMI. So I think BMI will remain in vogue. It's not going to go away. BMI will remain to be the basic criteria. Even recently, Lancet Commission came and they said that BMI should not be a criteria, but they themselves said, if this is the BMI, then you should measure waist hip ratio and you should do DEXA and all those things. I think
Right.
BMI will remain. It will not go away.
So the other factor is about, in terms of awareness, which you mentioned, the CBSE, the Central Board of Secondary Education, has started an initiative with all of its schools throughout the country on sugar boards and oil boards. That is to reduce childhood obesity and dependence on sugar. So, I mean, we've been doing programs from our institute for a couple of schools around the belt over here. So, just to let you know, because I think this is hit hard right now in terms of the statistics, in terms of young kids just being couch potatoes or sitting on their screens, not exercising, no exposure to the sun, and eating a lot of processed food. So this has become an in vogue. I can share those letters on the group, but yeah, that's to create awareness.
I think the sugar boards which came are very important. Every institution should put up, especially in their canteens and cafeterias, so that when somebody is eating unhealthy, at least he knows that he's eating unhealthy. It's like a warnings on cigarette packets.
Yes, sir.
Warnings on food items are going to come soon. There's a lot of discussion for last 2 years on food item, but the industry is pushing back because the
Right.
food industry doesn't want the warnings coming about cancers and about organ failures. But yeah, I think what you're doing is great. I think other people, there are a lot of business people here. They must put it in their schools, colleges, hospitals, everywhere where people eat. Awareness is a gradual and long-term
Yes.
investment. Yes.
That's what we do at RCODI.
Thank you.
Create
Sir.
awareness on organ
That's
donation.
great. Yeah.
Thank you, sir.
Thank you, Dr. Moniz.
Dr. Goel, it was very enlightening presentation. Thank you very much for clearing some of the cloud.
Thank you so much.
Two issues stand in my mind. One is weight gain is a slow process. What in our thinking system stops us from taking early action because we know what bad things will follow. The second is the young people today have complicated set of lifestyle. Screen time is lots more, and it is happening in the entire family. Parents are busy watching different things and different things. Do you think as doctors you all can create some kind of atmosphere where more sensibility starts early in life by changes in parenting?
I think what you are asking is such an important two aspects I realize from your question. Thank you so much. One is obesity is not a willpower issue. Please realize we always believe that somebody is not taking care of himself and that's why the person is gaining weight. It's wrong. The disease is there. Disease is there. Now, if the person is eating healthy, he or she may not become very obese, but the person will gain weight because the disease is there. So, early identification of these people and their education. Now, education will only come if parents are aware of it. The problem is that we have generations where we never had a discussion on these issues. So, parents, grandparents have hardly been talking about healthy eating. We talk more about eating Indian food, but if Indian food is also not good, you don't criticize that. Now at least the government has, well the cat, that there's openly started talking about that what is unhealthy in Indian food. So I think a very good initiative, a right move has been done. It's just a matter of time. It will take probably a generation or two before we will start seeing a decline in obesity. But at least some initiative has been done. We have been asking for it for many years. I was president of the National Obesity Association 2007 to 9, and we had meetings with WHO at those days, and we could not get this implemented. But I think now the time has come that government has started taking this thing, and it will change, but it will be a very slow change. But till that time, people will have to suffer, because till that time they will have to take medicines, because if they are suffering from a disease, there is nothing else that can be done other than medicine, or in some very few cases, some surgeries.
Thank you, doctor, for answering all the questions patiently. And we all have a lot of questions, but we don't have time on hand. I request Rotarian Hemlata ji to please give the vote of thanks.
Dr. Raman Goel, your speech was truly showcased your remarkable excellence in both diabetes and the obesity. It's very informative and useful also. I, Rotarian Hemlata Bandari, on behalf of the President and the Rotary Club of Organ Donation International, would like to express my sincere gratitude to all of you for attending and watching this informative and inspiring meeting live. Thank you once again.
Thank
Thank
you
you so much.
Meeting is there.